Okay. What's up? Oh, apparently saying "what's up, guys" is not cool anymore. I don't know. But I guess it's a podcast, so I can do what I want. Also, I can do what I want. It's mine. My podcast. No one telling me what to do. Okay, because today we're talking about caring less. This has been something I've struggled with for a long time. But look, today I'm caring minimal amounts. Because, one, I'm pretty used to the camera now. I need to put this pen down. I keep doing this, and then I, click it. I, click the pen. I, turn and click it, and it's probably very noisy. So, yeah, you can see if you're on the YouTubes, I am channeling low care vibes. For those of you who are listening, basically I'm not wearing a bra. Not that you can see that in the video. In fact, it cuts off at upper chest. So, boobs aren't even in the question, really. But I'll inform you that I'm not wearing a bra. I showed up on camera with my dressing gown on. I just took it off. I washed my hair, which is like a once a week fucking miracle because that never happens. And it's up in a wet top bun. Is that what you call it? I don't know. I'm not cool enough to know what that means. What the phrase is. It's great to be back, even though I only spoke to you yesterday. I think I podcasted with Izzy yesterday, my friend, and it went on for a long time, which I have no issues with. And I had a good time. It was nice to talk to somebody, except myself, because that's what I spend most of my time doing. Just for those of you who are listening on the daily, my jaw is still bad. I think I mentioned it yesterday. I've got a bit of a lisp, because my occlusion, which is your bite, is not right. My bite's not right. Basically, I don't know what's happened, but my jaw has some kind of issue on the right. It's swollen. I don't know. Not really. You could maybe say it's slightly swollen to feel. But anyway, it's not that obvious. I think the TMJ joint, the temporomandibular joint. I think it's temporo. I'm just trying to remember, is it temporal? Oh my god, this is embarrassing, right? Because we just say TMJ. I just don't think about what the I know it's temporomandibular joint. Shut up. Okay. So yeah, that's my vibes. Oh yeah, I was saying that my jaw hurt. Basically, I went to the hygienist. I don't know if I've strained my jaw from having it open, but I wasn't there that long. In fact, she said my teeth were pretty good. I was going to say perfect, but she didn't say perfect. She said everything was minimal. Minimal is the word that I like to hear, unless we're talking about how much hair I have left on my head, or how much life I have left to live, or how much money I have left. Then minimal's not a good word. But minimal plaque, minimal gum disease, that's something I want to attach minimal to. Okay, today we're talking about caring less. That was a long old intro. It was 4 minutes. Oh, I'm talking about caring less because I just think everybody cares too much. Look, there are things to care about. There are. But there are also things... Maybe I'm on the wrong end of the spectrum, I don't know. I'm on the sort of looser end of the spectrum. Now that's an adjective you don't want attached to you. Minimal, loose. So now let's talk about why my journey of caring less, because I think Everyone definitely needs to know. By the way, if you hadn't realised, I think I need to point this out because I don't think it's that obvious sometimes. I'm quite sarcastic. And if you think, oh, was that a joke? Did she make a joke? Yeah, I probably did. If you think, oh, that was a bit risque. Was that a joke? Yeah, probs. So, just take that into consideration. I just winked. I never wink. Okay, I'm in a silly mood, which is weird because I thought that I would be very tired. I am very tired. Maybe that's why I'm silly. It's 12 at night, literally just turned, so I don't know, I do everything last minute. It's a problem. I'm not even getting to the point here. Right, caring less. I think everybody cares too much. It's very ingrained. Caring, obviously, is ingrained in medical life. And I think some specialties, not naming any names, definitely care significantly more than others. Maybe I should name names, I don't know. No, I won't actually, because I don't want to be in trouble. But there are ones that put a lot of onus on the patients. It's your job to contact us and to get back to us, because generally they're so overwhelmed with work that if they followed everybody up, they literally would, I don't know, I was going to say die, but that's a bit dramatic. They just wouldn't, there's not enough hours in the day, let's put it that way. So yeah, caring, pretty ingrained in being a doctor. So from the first few, even in the first week, it's literally it's just, firstly you probably go into it because you are a caring person. So maybe I'm, a subsection of the population that cares a bit, quite a lot. And I think medicine definitely, doing the course and the job definitely enhances that because, firstly, yeah, you should probably care about what you're doing. Otherwise, what are you doing in that job? And if you don't care, then it's kind of like a patient safety thing, orcs. But also people want you to care about them. That patient might rarely see a doctor, so that's their kind of, one kind of touch with the medical profession or NHS or whatever, maybe that year or first time in their life. And yeah, caring is important, that's what I'm saying. But how do we know when we're caring too much? That's the question. So I'm going to tell you what happened to me in F1. F1 was a bad year. So F1 is this, by the way, this podcast's not just for doctors. If you're fuck, she's going to talk about loads of medical stuff, don't worry, I'm not. I don't know that maybe medicine isn't for me anymore. I don't know. That's a quest I'm going through right now. It's a real life. I'm having a midlife crisis, essentially. Help. No. Oh my god, that was such a nervous laugh. So what happened in F1? So F1, I was saying, F1 is the first year out of medical school. Medical school is 5, maybe 6 years. Everybody thinks it's 7. It's not, because those 2 years after you come out of medical school are the ones where people probably think it's 7. You get a provisional license after you finished F1. So you're a bit of a not quite a doctor as an F1, but you are, but you're not ticked off, you haven't completed it. And then F2 you still have to kind of complete before you can get let out into the world, but you're a fully registered doctor by that point. So F1 was a bad year for me. Lots of things happened. I've talked about this in other podcasts. I do not need to rehash it. Just go listen to those. I think it's called The Worst Year of My Life, so it's pretty aptly titled. That year I struggled with anxiety, depression, and that in turn affected my sleep. My anxiety when I tried to go to sleep was so bad, I'd just be like constantly thinking about things. Like, what have I forgotten something? I cared too much. I think I was just worried as well, like, oh, did I forget to, I mean, I was, probably not a very good doctor at that point, because like everyone's, we're in our first few months of being a doctor, so you're not at your peak, let's put it that way. I'm not talking about other people, I'm just talking about me. So if somebody listens to that and goes, I'm an F1, you just told me I'm not at my peak, like, I mean, it's probably true, but I don't know. You can judge that for yourself. But yeah, you got a lot to learn in F1. That's why you're doing it. I feel like I'm just digging myself a hole of regret. But so you do F1, and it's like, like I said, probably not like an amazing doctor, because you're me. I'm trying to like figure out, what does an INR of 8 mean? Like, I knew it was bad, don't worry, but like, it's just all contextual, isn't it? You're like, I don't know, what does this even mean? Does somebody like go to the, I don't know, like cut themselves on a bed sheet and like bleed out with an INR of 8? I don't know. They don't, but that's the kind of things that go through your head, and you don't know what you don't know, so sometimes you don't even register that INR of 8 is like bad. So then you go home and you're kind of like, oh, I forgot to do that. So this happens, I feel like, more often than it should with doctors. Is I went back in when I to prescribe some antibiotics. I should have just rung the on-call, like that's what I would do now, but I think I'd forgotten, and so I called. It was like some oral antibiotics, it wasn't mega, but I called the no, I didn't. I didn't call the on-call. I went in because I lived right by hospital, so it didn't seem that bad. But anyway, when I got in, I was like not wearing my doctor clothes. I'd been at home or at the gym or whatever, and I think I had my badge, but I turned up, and then the nurses were like, oh my god, like freaking out because someone was sick in one of the side rooms, and then I got involved in like kind of resuscitating that patient. It was it was a weird time. I was like in my gym clothes, like, I am a doctor, don't worry. But anyway, that was maybe not the highlight of my life, but anyway, what I'm saying is I was kept awake a relatively significant amount because I was just caring too much, worrying about patients. Like, it would all go through my mind, like, did I document that? Did I talk to them enough? Did I tell them specifically? Did I, or should I have handed that over? And I'm kind of at a point now where I recognise my limits. I also forget less. I write everything down, because then, it's a nightmare if you forget to do stuff. It's like, I feel like I'm being really witty, but also then I feel like I'm not, Because I'm listening to myself and I'm like, am I just rambling shit? I might be. I'm quite tired and I'm just rambling. Whatever. People like to listen to that. So, let's go on to the point where through your first years as a doctor, and this is so applicable to other jobs as well, especially like professional jobs where you're like constantly monitored. Anyway, as an F1 and F2, you're very heavily monitored because you're new and baby. And that's kind of the time that you're probably going to make the most mistakes. So you have these like team assessment of behaviours, or multi-source feedback, or 360s like they call them, but they're like reviews, like what did your colleagues think of you? And it's always, I don't know, it's someone always brings something up, like, and then that kind of brings in the paranoia and the anxiety of, was I, nice enough to that person? Did I say something horrible when I was, or snap a bit when I was like hungry or whatever? And people remember those things, even though the form says a general overview, not a specific like one-time event. But anyway, people remember. And you can fail parts of your like year if you don't get good feedback, or you don't complete all of your competencies or whatever. So there's there is stuff riding on it. Oh my god, I'm so sorry about that. Okay. The anxiety for me, I would lie in bed and then the thoughts would go through my head and I would get like pounding, like not fast, like my heart wasn't fast, it was just I could feel it was like pounding. And you can't really sleep when your heart is behaving like you're climbing a ladder, or I don't know, that was a weird object to climb. Well, it's not actually, because you would climb a ladder, but it was a bit of a rubbish one, wasn't it? A bit of a rubbish analogy. You can't really sleep when your heart is acting as if you're doing chest compressions. I don't know. Whatever. So that took me a long time to get over. And look, I still give a fuck about what people think about me. And I say the word fuck because I actually forgot to mention the book that I read is called The Subtle Art of Not Giving a Fuck. And I honestly do recommend it. If you're listening to this podcast because you give too many fucks, go and read that. I can't really remember fully what it said, but like, I remember it being good. And my mind would remember it if I like went, flipped through the book. But it was a long time ago that I read it, like 4 years ago or something. So, but it's left that lasting memory of goodness. So anyway, so that's where the fuck came from. It was a bit unsolicited otherwise. But yeah, I do still give a fuck about what people think. Mainly about what they think about me. So my biggest, maybe I shouldn't reveal my biggest like problems. But there we go, we're just laying it out on the line today. God, I need to get some energy. Whoa. I feel like I'm... Oh dear. Okay. People are so complicated. Humans are so complicated. They really are. Like, the interactions between people are so complicated. And some people aren't very nice. No shit, Dawn. Come on. So yeah, look, I do still care about what people think about me. And I only care about what they think about my actions. Or like, whether they think I'm like bad at my job, or whether they think they think something about my personality. I care so much less about how I look. I do look beautiful like all the time, so it's fine, but sarcasm. But no, I used to care. Like, would I have even been on camera? No. A few years ago, no. Would I have been on camera looking like this? Like, I don't look bad. I just, I'm not like, I don't wear makeup. I stopped wearing makeup literally when COVID happened, because we had to wear masks all the time. It was just like spots, and no, it was a nightmare. And I was also like, no one can see my face, so why do I care? And then I just never went back, because who's got like an extra 20 minutes in their schedule and when I could be sleeping or doing something much more fun, like podcasting. There you go. Or I could be putting on makeup. I do it for very special events, like a fucking wedding, or maybe at a push my birthday, but no, probably not. Events where there will be lots of pictures. Actually, that's just every day, isn't it? But yeah, weddings, the things where I get like glammed up for. So I haven't seen myself in makeup for like 3 years, so that would be a surprise. But yeah, I don't know, I think I care less about what people think about how I look, because I've been on camera so much. I don't really care now. Like, I wear literally pajama potato sack scrubs every day, and I'd rather wear that than wear actual clothes and look nice. And I wear leggings most of the time. I don't know. I'm not trying to impress anyone. No one's judging me probably on my appearance, so I don't even brush my hair. Because I don't know, I don't need to. It's up all the time. But yeah, so I don't really care about what people think about my looks, but I know that how I behave and how competent I am is monitored. That is monitored. Like, people give a shit about that because it matters. And that's probably why. But look, I actually wrote, I don't know why, but I think I've just had an epiphany. I think I've just figured it out. So you just witnessed history right there. But I don't know how to stop caring about what people think about me. Maybe I just need a job with much lower stakes, and a job where it's like, well, whatever. I don't know. Like this. Do people care? Like, I don't know. Maybe they do when people start actually listening. But at the moment, I don't feel like really anybody cares. So I could probably just sit here naked and no one would know. I'm not going to do that, don't worry. So, oh my god, I've written dating on Twinder. I've written dating on Tinder. Guys, we need to talk about this, because I think a lot of your self-worth comes from Tinder, and maybe that's why I care less about my appearance, because I am in a stable relationship, so I'm just like, whatever, I've let myself go. That's what they say, isn't it? So I mean, dating on Tinder is all about what people think about you, especially about your looks mainly, and then it's those first impressions. And I'm guilty of probably being judgmental. I mean, you're judging people, of course you are, on a date, because you're like, are you going to be my life partner? Are you? So I think, oh my god, Tinder, why? I just feel like I've never been in a place where, I mean, to be fair, my first 2 boyfriends I did meet in person, so I can't play that off as I've never been in a society where online dating is not a construct. 2 double negatives. But look, I dated on Tinder for a bit, because why not? Broke up out of like a nearly 4-year relationship, and that's what you do, isn't it? You have a little browse, little gander. I think, by the way, I think someone needs to create a Tinder for houses. And I know you could say, well, Rightmove, but no, I want to swipe like left and right because I want to be like, no, and just like get out of my mind and out of my feed. So Tinder or, Rightmove, come up with an option that you could do that. That would be really great. So yeah, I tended to go for guys who unfortunately a lot of people also I don't know, sometimes I just say words and I'm like, no, that didn't work. They also fall for, I don't know, whatever, they also want to date because they make you feel excited. And I guess that is because they make you feel insecure, to be honest. They do. They make you feel like you're living life on the edge, and isn't that exciting? They make you feel like they are unavailable, and that makes you want them more. So I feel like I cared too much about what these people thought about me, and about getting their approval, and probably going for guys that were more unstable or made you feel kind of unstable, rather than guys who made you feel safe and secure. So I've definitely learnt a lot from that. Care less about what people think about you, because like if they don't like you, if you meet them on a first date and they don't like you, does it matter? Like, if they don't like you, then fuck them, because don't try and gain somebody's attention or care about what they think about you. They either think they're better than you, or they just, I don't know, I'm going to say it, they just don't want to date you. But that's fine, because you don't want to be chasing after somebody that isn't good enough for you. Okay? Giving some real life advice here. I said wait there because I had to reset the camera. It does this really annoying thing where it only records for 30 minutes, so I need to try and figure out whether I can change that. Yeah, so I've learned self-worth, especially when dating. Just care less about what they think, You put on this, like, all this makeup and look really nice for a first date, and of course it's nice to do that, but I don't know. Maybe I'm only saying this because I'm not single. Okay. How do we start to care less? I think some of that comes from, firstly, a lot of work. I had to work on my self-worth and learn the hard way, unfortunately. Getting rejected and then being like, I don't quite like this. Why am I going for these guys that are just twats? I'm not saying all guys are twats. I'm just saying the ones that I went for seemingly had something in common, okay? And so time, I've had, not gonna lie, I mean, people know this already, I do have a counsellor, private counsellor, and I've had CBT on the NHS before. So if you care too much to the point where it's giving you anxiety and mental health problems, go and sort it out with someone. It's a no-brainer. Yes, there's a waiting list, but just get yourself on, and then you're done, aren't you? But although it's been a long process, I'm obviously still not there. come on. And the thing is, we care so much in our 20s, especially about what we look like. I guess in a way our personality is still, mine's probably finished now, so I'm kind of stuck with this, but our personality over that time is like developing. So we're kind of figuring out, what do I care about and what do I not? But looks, I think, we look arguably, according to social norms, we look the best in our 20s. Yet that is the time that we care so much and are so think so negatively of our physical self that it's actually kind of ironic. And by the point that you get to, like, you know, you've had kids or whatever and you're like 50, like, they're the people that I see and I'm like, I aspire to you, because they're just like, whatever. Like, especially as a doctor, a lot of the younger patients are very nervous about getting bits out. The older people, no, they do not give a shit. They really don't. And they know that I don't give a shit either, so it's like a mutual understanding. So as well as time and therapy and antidepressants, and just learning the hard way, how else have I done it? Guys, I need to turn you over to the dark side, because I've joined an improv theatre and I fucking love it. I feel like a silly little sausage running about, saying crazy things, anything that comes out of my mouth. And I just say it, and, you know, within reason. Before, I had a very strong block on what I said. And I think the thing is, I didn't have that when I first started medical school, and I just sort of, I didn't say what I thought. I did have some, you know, oh my god, what is the word? I had some control. And people thought I just had verbal diarrhea, but no, I did have some kind of barrier. But then I think my barrier became so big throughout F1 and F2 and throughout medical school, to the point where sometimes I felt paralysed by, like, not saying the wrong thing, that I would just be like, oh, you know, just holding back. So improv is literally all about just saying the first thing that comes to your mind. And it's just so freeing. Everyone just has fun. It's such a good time. It's much less scary than you think. I mean, maybe I've got good theatre. It's the Bristol Improv Theatre. And obviously in Bristol. And people come far and wide to it. It's a very safe space, and they make everybody feel very comfortable. A lot of people are very nervous when they first come. And yeah, silly, and you let go, and it's bloody great. But talking about letting go, I'm wondering, this is something that's going on in my mind and has been for a while. And this is just, you know, talking about any old job. If you don't work in medicine, but you have a job that you're like, I am not vibing with it, then maybe it's time to let that go. It's a difficult severance, to be honest. I don't think I want to leave medicine completely, but I don't know that I want to do clinical medicine. If you want me to do a whole podcast on this, I will. Just, like, put it in the YouTube comments or something. But look, I went into it when I was 16. I did not know, 1, what I was getting myself into. 2, things have changed since then. And 3, I've changed as a person. for? Do you really know what you want at 16? Like, no, I don't think you do. But you have to make this quite big life decision. Anyway, I don't regret going into medicine. It's given me, a great life generally. I can work anywhere. I'm very employable. I've got loads of really good skills. And I've seen lots of very interesting things. But I'm wondering if now is the time. Do I let go? Do I want to, I don't know. Look, I'm exploring other options. But anyway, yeah, improv. I love it. You need something that is like an outlet for that. And it's like, think about it, right? What do you care about too much? Is it like you care about how people think about how you look? Well, why don't you try going out without makeup on for a day? Why don't you try doing a dance class? Why don't you try just one small thing? Because if you don't change something, it's going to be an even slower and more painful process. Come on. So this is why I'm on my bum. I've been sat on this really hard bench for a few hours now. It's not good. This is, I'm all about self-improvement and going through life and improving every day. On the weekend, this weekend, literally like the day after tomorrow, I've joined up to this class where it's like dance body movement. So you literally just like flow. If you're just listening to the podcast, I'm winding and I'm moving my arms. Like, I don't really know, an octopus. That's what I look like right now. So that's just an image for you. An octopus without the suckers and the extra 6 legs. Wait, no. I have got 4, so extra 4. But you can't see the other 2, so yeah. Just I'm a 2-legged octopus. Another thing that I did was that we went to a pottery class, and me and my friend Izzy, who, again, you might have seen her on my videos or the podcast, she and I went to a pottery class. Did I just say that? I don't know. Anyway, I haven't got the vase in here, but I painted a vase. It's fucking great. And I am very much an overthinker, and I can't just like let go and basically care less. I was like, oh, what design am I going to do? And I really tried to let that go and get into the mindset of just paint whatever, because you're not Picasso, like you're not Tracey Emin. She never painted, I don't think, but a throwback to Tracey Emin. You're not Banksy, like you're Dawn, and you're trying to have fun. So care less and just accept that it might not be the best artwork you've ever seen. So I think maybe the way is, and I've just thought about what those two things have in common, they're both creative processes. So try and find some kind of creative process and just let go. It doesn't have to be crazy improvised dance class or also improv, because those things are quite heavy to jump into. As in, people have, not heavy as in like you shouldn't go and do it, but heavy as in people are anxious to go and do it. And I encourage you to go. You don't need to be anxious. They're very lovely. It's very fun. But look, find a creative process, one that you're comfortable with, and just let go. Just do whatever. Just do the flow. And, yoga's a good one. Especially the instructors that just do what feels good for your body, and you're not I need to follow their exact instructions, must follow. No, just do what feels good for you. Let go. I think that's going to be it. I hope you enjoyed that. I did. I feel like I'm a bit So it is quite hard to talk to and with yourself for 40 minutes and stay very lively. But look, we're working on ourselves, okay? That's the end of today. I'll see you, it's already the next day now, but I'll see you in tomorrow's podcast. I have no idea what it's going to be about yet. If, you have any ideas, please let me know, because I'd be grateful. And yeah, thanks for tuning in. If you listened all the way to the end, congratulations. Also, congratulations to me, because I was that enthralling that you chose to listen to me for 42 minutes straight. Congrats to me and you. Congratulations. Okay, that's enough. Bye.